Welcome back and good day. In this episode number 7, I'm going to be talking about healthcare delivery imperatives, and specifically 3: quality and safe care, timely care, and access to care. Up to this point in time, we've been talking about, among other things, exposures and risks that both organizations and individuals face as it relates to healthcare delivery. What we're going to do and explore here further is that without the delivery of quality and safe care, without ensuring access to care, and without timely care, we're not going to be delivering on those important imperatives. As a quick reminder of where we are in our journey in episode number 7, I am contemplating a total of 30 episodes that I'll record over the course of this series. And I want to remind you that all of these episodes are posted on this YouTube channel. If you've not already subscribed, you may wish to do so. Feel free to provide feedback at any point along the way. And last but not least, if you have any friends or colleagues whom you believe may benefit from this series, please go ahead and share the YouTube channel link with them. Although the phrase, "first do no harm," is often attributed to the Greek physician Hippocrates, it is not part of the Hippocratic Oath. In fact, some individuals attribute it to another of his works called Of the Epidemics. Others attribute it to a Parisian pathologist. It doesn't matter. It's a core principle of healthcare. And even though lots of other issues swirl around our soon-to-be $6 trillion healthcare industry in the U.S., and by the way, these include, for example, cost reduction, increasing productivity, pharmaceutical costs, optimal care venues, moving from volume to value, price transparency, overall improving outcomes, etc., I'm going to focus on 3. From a patient's perspective, I would contend that the 3 key imperatives are what are shown on this slide: quality and safe care, timely care, and access to care. Quality of care, of course, is all about achieving desired health outcomes. To deliver quality care, the care must be effective, it must be patient-centered, and it must be safe. And speaking of safe care, patient safety is all about prevention of errors and mistakes that would have adverse effect on our patients, going all the way back to the famous 1999 Institute of Medicine study, which concluded hundreds of thousands of lives are lost to unnecessary medical mistakes every year. We still today wrestle with that issue in healthcare. We should be asking the question, with all of the digitization that we've undertaken in healthcare, are we in fact accelerating the rate at which those medical errors are made, or are we in fact helping and decelerating the rate of those medical errors? With healthcare, with the burgeoning blitzkrieg of deployment of technology we've had over the last 10 years, 12 years, we've had new technology, new systems, new data, new devices. And the question remains, are we able to deliver on these 3 key imperatives given this blitzkrieg of technology deployment that we've had? Timely care, of course, is making sure that the system has enough capacity to provide care when it's needed by our patients. And last but not least is a matter of access to care. Access of care depends on lots of things, ranging from insurance coverage to services being available, including those that are required and important for prevention and testing, as well as having a workforce of capable, competent clinicians to deliver that care. What we've covered in this episode is the concept of healthcare imperatives, including the 3 that we've just went through: quality and safe care, access to care, and timely care. The question I posed earlier is related to the following. Without reasonable and appropriate cyber risk management programs in place, are we able to deliver on these 3 important healthcare imperatives? No matter where your organization fits in to the healthcare ecosystem, I think it's important to keep these imperatives in mind, and more specifically, to analyze and understand how your organization may affect quality of care, timely care, and access to care. Again, no matter where you are in the healthcare ecosystem. As always, I'm wrapping up this session with a set of suggested actions as well as references and resources. I encourage you, while the material is still fresh in your mind, to have a look at some of the actions, consider undertaking them, and consult with the resources that are provided. In the next episode, I'll be following up on these healthcare imperatives and beginning the conversation about how critically dependent they are on underlying clinical processes and information assets. And specifically as it relates to information assets, I'll talk about three types: traditional IT assets, I'll talk about the Internet of Medical Things and biomedical devices, and last but not least, I'll talk about the Internet of Things and all the devices that are being added to our networks, all of which must be risk analyzed and risk managed, because any of which, if there's a compromise, can result in the compromise of our ability to deliver quality and safe care in a timely manner and in a manner that provides access to those who need it. In the meantime, subscribe to the YouTube channel, be well, be secure, and I'll see you in the next episode. Thank you.